Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations Tonight with Marty Ross MD. As you know, this is a webinar where we're going to talk about Lyme disease, and what we talk about depends on the questions you ask me. So for those of you that are new here, the way you participate, there's two ways. Number one, you could listen to the questions as I read them, and you can see what the responses are. Second way you can participate, though, is write a question. And the way you do that is over on the bottom side, the right-hand side at the bottom is a chat box area, and you can write your question in me directly in that chat box. I had been previously requesting that everyone click on the question mark that's in that area and then write your question to me after you clicked on that question mark. You don't have to do that. Just write it in the regular chat box to me. Now, keep in mind, everyone, that there are many more questions than I can get through, although I do a pretty good job getting through a lot of them, as you know. And so just keep that in mind. I'm not trying to ignore anyone's questions. It's just that I don't get to everything. During the webinar tonight, I am creating a recording. I will provide a summary of that recording and get it out to you in an email tomorrow morning, somewhere between 9 and 9:30 in the morning is generally what I try to do with that. This is the last webinar for the month of April. And so I will be off next week. And then we'll be back in with you again the first week in May. So that's what's going on here. Tomorrow morning, when you get that email from me, the one thing I request is that you share it. Send it to everyone that you think might get some benefit, either in what we talked about in the webinar or in participating in future webinars. Trying to reach as many people as I possibly can here. And I invite you to help me reach those people that have these issues so that they get help the same way that you're getting help here too. Okay. All right. So let me see. I think that summarizes everything. Oh, in terms of writing your questions to me, the main thing I ask when you write that question is that you try to be brief. Long questions don't work out in this format. If they are too long, I just won't read them. I'll ignore them. And secondly, as you're writing the question, don't click the enter key until you're done. I need a whole question before you click that enter key, because once you click that enter key, it actually sends the question to me. Okay. All right. So without any further ado, let's go ahead and get started here. All right. It's a question from Jim. Hi, Jim. Let's see. Hi, Dr. Ross. Thanks again for these great webinars. You're welcome. Let's see. I've been taking Diflucan the last 2 weeks for pain when urinating. About day 10, I started getting a lot of gas pains, so it seemed wise to drop the dose from 200 to 100 milligram. I will try to move back to 200 milligram, but if side effects are too strong, is it okay to take 100 milligrams daily until the 30-day period is over? And if I can only take 100 milligram Diflucan, should I add something else like caprylic acid? I'm also taking nystatin, but I'm pretty sure nystatin isn't causing the gas pain, because I've taken a lot in the past and it has never caused problems. All right. So as you can guess, I'm not your doctor. I don't get to ask you 1,000 questions here, Jim, about what's happening with that gas pain. Okay. So I'm just going to address one part to your question, which is, what is the dose of Diflucan that can work to get rid of candida in the urethra or in the intestine? So the most effective dose is 200 milligrams. However, 100 milligrams can work fine too. And so for some reason, if you can only tolerate 100 milligram dose, if you're a person that can only tolerate 100 milligram, it'll still get you there. It may be that you need to treat a little bit longer, but it will still get you there. If you are having a lot of gas pains and you're suspecting it's the Diflucan, I would urge you to talk to your physician who prescribed this for you and have them help you figure that out. Okay. Because although I talk about medical ideas here, I'm not your doctor. I can't substitute for the role of a physician here in these brief webinars. Okay. All right. Good luck to you, Jim. Hello, Anna. Let's see. Hello, Dr. Ross. Which general antibiotics would you recommend to treat both Lyme and H. pylori infection? Among your patients, do you see more susceptibility to H. pylori if someone has Lyme? And number 2, which Lyme bacteria and co-infections causes blurred vision? Does one's eyesight improve after successful antibiotic treatment? Okay, so H. pylori, everyone, is a bacteria that can lead to infection or causes infection in the stomach that can sometimes give you stomach pain, basically. All right. If you have it, the standard treatments as used in prescription medicine is to use a 2 prescription antibiotic protocol and also put a person on medicines that lower stomach acid, proton pump inhibitors. One of the regimens that is recommended is clarithromycin along with Flagyl. And so Flagyl, also known as metronidazole and clarithromycin. Right now, in the world of Lyme, clarithromycin is useful to treat spirochete Lyme and also Lyme that lives inside of cells. Flagyl is used to treat the cyst form of the Lyme. So a treatment using that to treat your Lyme would also be a treatment that could take care of H. pylori. Okay, so that's one way to skin that cat, basically. All right. And then number 2, let's see, in terms of bacteria and co-infections that give blurred vision, in terms of blurred vision, that's neurologic symptoms typically. Okay, so the blurred vision either is coming from problems with the optic nerve, the nerve that supplies the eyeball, or the blurred vision is being caused by the nerves that make the eye muscles work the way that they're supposed to. Okay, so it tends to be a neurologic dysfunction issue. The 2 major infections that lead to neurologic dysfunction in the world of Lyme disease and tick-borne illnesses is Lyme, the Borrelia infection, and also Bartonella can do that sometimes too. Can you get vision to return to normal once you get those infections under control? Yeah, I see that happen all the time in my practice. So yeah, it's very possible that you can a person can get back to normal vision then. Okay, all right. Good luck. Hello, Anthony. Let's see. Hello, Dr. Ross. I've been sick for 5 years after shoulder surgery. 24/7 headache, dizziness, light sensitivity, eye problems, chest tightness, slight sore throat, and fatigue. I've had every mainstream scan and blood test, all negative except CFF's protein, which is elevated at 61. CSF white blood cell is normal, and white blood cell on the low side of 3.7. Can I have an infection with normal white blood cell count? Any advice on a co-infection? Thank you very much, Anthony. Let's see. Bear with me. I'm just reading back what your symptoms are here again. Headache, dizziness, light sensitivity. All right. So, Anthony, I'll make a few observations here. So, number 1, can you have infections with normal white blood cell count? The answer is yes, you can. High white blood cell count usually means an acute infection, bacteria acute infections, but chronic infections usually have normal white blood cell counts. Okay. And then let's see, in terms of your symptoms and infections, I would need to ask you a lot more to help kind of center that a little bit more. I need to know more about your risk factors for possibly getting Lyme disease. I need to know a whole host of other symptoms than what you put down here. So it'd be very difficult for me to assess what infections this might be in terms of helping you determine where to go here. Okay. So I'm sorry, I can't do it. I need to ask you a lot more than what you wrote down here. All right. Good luck to you, Anthony. Hello, Gail. Let's see. Hi, Dr. Ross. I was under the impression over the years that it is best to treat co-infections before Lyme. Is this true? Number 1, do you generally treat Bartonella in your patients before treating Lyme, or do you base the order of treatment on symptom presentation? All right, let me answer that part of your question first. So, the way I handle Lyme disease and co-infections is I always treat Lyme. All right, and I will pick up at least one co-infection. And if I can, based on the person's response and how sensitive they are to medicines, over time, I may add in treatment for 2 co-infections while I keep running the Lyme treatment. Okay. So if I've got somebody that has Lyme, Bartonella, and Babesia, generally, and all things being equal in terms of symptoms and effect that they're having on the person, I'm going to treat for Lyme and Bartonella first and set aside the Babesia treatment. The reason that I tend to stage it that direction is that there was an observation that Burrascano had when he was still in practice. Burrascano, everyone, is one of the country's Lyme pioneers. He's the one that came up with how we treat a lot of these illnesses. And it was his observation in his Long Island practice that when people had Bartonella and they had Babesia, if efforts were taken to get rid of Babesia before getting the Bartonella under some control, then it became much more complicated to get rid of the Bartonella. Okay, that was his observation. Now, there's no science behind that, but that was his observation. And because of that, that tends to be my approach. Now, there are times that I will work towards going for Babesia and Lyme before I do the Bartonella and Lyme. And the reason, sometimes when I'll do that is if I ask somebody that what their symptoms are, and it's very clear to me that the major problem of their distress, the thing that's throwing them off completely, is their Babesia, I may go for that initially, maybe get a couple months into treatment along with treating Lyme at the same time, and then add in Bartonella treatment at that time. Okay, so that's my approach. Okay, let's see here. Let's see. Also, I have several friends who see Dr. Mozenyani for Bartonella. They're all saying that he is moving away from treatment with rifampin, rifabutin, methylene blue, because rifampin, rifabutin causes adrenal fatigue, and too many Bartonella patients have had adrenal fatigue. Not sure why he's stopping the methylene blue. His new protocol is clarithromycin, oil of oregano, oil lisinin. What are your thoughts about this treatment protocol? In your view, can this sufficiently kill Bartonella? All right. So I know Dr. Mozenyani periodically comes up with different directions he's moving with his practice. What I would say is there's many ways to go after Bartonella. And if you're looking to see all the ways that you can go after Bartonella, take a look at the most recent publication I made. I updated my article called Kills Bartonella, a brief guide, just last week and republished it. But generally, I don't know that I agree with Dr. Mozenyani that rifabutin and rifampin always lead to adrenal fatigue. Some of my treatments do involve using rifampin and rifabutin. Many of them don't. There's complete different ways you can design treatment that don't use rifampin and rifabutin. In terms of methylene blue, he had been including that in here because there's some evidence that methylene blue can help treat what are known as persister forms of Bartonella. But there also are additional ways you can go after persisters, okay? So without going through it here, what I would say is I have published an article. Take a look at it. It's called, I'll show you here. It's called Kills Bartonella, a brief guide where I outline a number of ways that you can go and get rid of persisters, and you can effectively treat Bartonella. You want to use at least 2 antibiotics that go intracellular. In addition, you want to have a person on something that's going to deal with the persister form of the germ. Things that deal with persisters are methylene blue. You can also use essential oils of oregano, cinnamon, and clove, or a combination cinnamon, clove, oregano. In addition, there are some additional herbs based on more recent research that came out of Johns Hopkins this year that shows that Japanese knotweed and cryptolepis, which historically we use, we historically use to treat Babesia, that it also has the ability to treat Bartonella and persister forms of Bartonella too, okay? So there's no one way. There's ways that work in different people depending on the person. And my approach that I would use is pick any of those. I'll show you all the approaches you could use. Go down that pathway for a couple months. If you're not getting better, or if you're having side effects, change to another way, okay? So I know Dr. Mozenyani tends to get very focused on a few specific drugs he uses in his treatment. I just want to let you know there's many different ways that you can go after Bartonella, all right? So let me go ahead and show that to you here real quick. All right, let's see here. So if you're ever looking to see what is the latest thing I updated, take a look at this button here called The Latest. And here you're going to see my Bartonella treatment guide, okay? And so the big thing that I've added in this update is one thing is I'm talking about taking efforts to remove fibrin nest, which are bundles of Bartonella germs wrapped with the blood clotting protein called fibrin. And what I'm using to get rid of that is the liposomal cinnamon clove. I'm sorry, is lumber kinase, excuse me, the enzyme lumber kinase. All right. The other thing that I added to this article that's a change from previous articles is instead of just talking about using oregano oil, I now talk about using liposomal cinnamon clove oregano oil. And then finally in here, I also have added in options to use the azole antibiotics, which is fluconazole and itraconazole, as part of a Bartonella treatment based on laboratory experiments that show that the azoles can treat persister Bartonella and can treat growing Bartonella. Okay, so for instance, this option right down here, this one I'm circling, is to use either fluconazole or itraconazole, that's your azole, plus either clarithromycin or azithromycin, plus either methylene blue or cinnamon clove oregano. Okay, look at all of these options you have here. I think that Dr. Mozenyani defines Bartonella treatment to 2 limited number of things that I have found effective with my patients. Okay, so up here I give you the list of how you would build a treatment. Down here I talk about the doses you would use on each of these medications. Again, I think my perspective on Mozenyani is he's too limited in what he does sometimes. There's many ways to go at this. Okay. All right. Now, that's not to, I don't mean to be critical. I mean, Mozenyani is a brilliant physician, but that's just been what I observed. Okay. All right. And then finally, I think you have another part to your question here. All right. Last part is PVCs, Lyme or Bart, any way to calm them down? So PVCs, so PVC stands for premature ventricular contractions. And, the one thing that I like to do when I have a patient that has their heart skipping around because of PVCs is I like to have them take magnesium, at least 600 milligrams a day. Sometimes that can help. If you are symptomatic with your PVCs, meaning you get lightheaded or dizzy with them, sometimes being on a beta blocker like toprol or atenolol or propanol can be useful as well, too. Those are prescription medications, okay? And then I think the last part of your question, you also said in your view, can this Mozenyani approach of using oregano, alicinin, and clarithromycin work? Yeah, it could. Again, there's many ways to go after Bartonella, though. Alicinin is basically the main active ingredient in garlic. Okay. All right. Thanks for that question. So one last thing, Gail, and about Bartonella. So Bartonella has replicates every 24 hours. Okay, so it's fast growing. On average, when somebody has Bartonella, it's going to take about 4 to 6 months for about 85% of people to get over Bartonella. There are about 15% of people with Bartonella that really just have difficulty. They can't quite get over it in that time frame. Okay. And so for those people, we just need to keep experimenting with different antibiotic regimens to see what's going to work for them. Now, in terms of how quickly do you make an antibiotic change? How do you determine if something's not working? Well, because Bartonella replicates so fast, meaning it replicates every 24 hours, it reproduces itself every 24 hours. What I have found is that if something is going to work, usually by 2 months, we should know if it's going to work. And if not, then it's time to change up and try a different regimen, of which there are many options that I laid out in that article. Okay. All right. Thanks for that question. All right. Let me see here. Some people have written their questions twice, so let me clear some of those out here. All right. This question is from Bob. Let's see. Hi, Dr. Ross. Are binders the only effective treatment to get rid of mold toxicity? We have a local doctor that primarily treats mold toxicity with personalized antigen shots. We must first go through a series of histamine, serotonin, and mold shot sensitivity testing, which requires being injected with small amounts of these to test sensitivity, similar to testing for food allergies. They call it intradermal provocation and neutralization. Thoughts? I know about the theory. I don't know if it works. I haven't had people go through it to see if it does make a difference. So I can't comment on it. Okay. All right. Sorry about that, Bob. Hello, Lynn. Hold on here just a minute. Let's see. Hi, Dr. Ross. I'm vaccinated and have had one booster against COVID. For Lyme and autoimmune issues, I'm taking low-dose naltrexone and a number of supplements that can inhibit cytokines, including curcumin, xyphlomet, glutathione, quercetin, NAC, BPC-157, and specialized pro-resolving mediators from fish oil. If I get COVID, will these cytokine inhibitors hinder my body's response to the virus, or do reduced cytokines not matter if I'm vaccinated? I'm wondering if I should discontinue all or some of these supplements temporarily if I get COVID and then introduce them after acute phase of the illness to guard against a subsequent cytokine storm. Discontinuing them has the downside of increasing my pain, inflammatory, and autoimmune issues, but I don't want to do anything to undermine COVID recovery since my risk level is a bit elevated. So you raise a really good question. So let me kind of summarize what the question is, everyone, or what the issues are with what Lynn is raising. So cytokines, everyone, is what gives you most of your symptoms when you have Lyme, right? And so when you have Lyme in you, your white blood cells see these germs, and they respond by making cytokines. But cytokines are good and bad. The purpose of cytokines initially is to turn the immune system on, rev it up to fight that thing, okay? And then once it is, but if the immune system doesn't do a good job, it's going to try harder and harder. Eventually, it's going to make too many cytokines. And too many cytokines give you what we call Lyme symptoms. They give you headaches, fatigue, cognitive dysfunction, psychiatric issues. They interfere with how your hormonal systems work, etc. So the mess of Lyme disease, a lot of it is due to excess cytokines, okay? So it makes sense to be on things that are going to lower cytokines, all right? So that's on the one hand, okay? On the other hand, the way that your immune system gets signaled to fight an infection when that infection moves in, like COVID, is you need to have your white blood cells release cytokines to signal to the immune system to rev up and to start fighting this thing, okay? So you raise a good question is, can you be basically too blocked on your cytokine production, inhibiting your body's ability to mount a response to the infection? And the truth is, no one has done research to know for sure, okay? However, my thinking of it is that basically that you cannot effectively wipe out a cytokine response, even with all the things you're doing. The body is going to override it, basically. And that in an acute situation of acute COVID, you will make enough cytokines to turn your immune system on to fight it and to go after it, okay? Secondly, since you've had the vaccine, you also have circulating antibodies that are going to be helpful right away anyhow, okay? So with my patients in situations like this, I am not telling them to stop their anti-cytokines because I still think that the body is set up to deliver a large enough amount, even if you are blocked down, that the antiviral part of your immune system will turn on and take care of it, okay? Thanks for that question, Lynn. I'm just giving you my own observations, that I have no science to guide me on this, okay? All right. Good luck to you. Hello, Bob. Let's see. Hello, my wife's new Lyme doctor wants to treat her with low-dose immunotherapy shots. Have you used LDI with your patients? Have you heard of Lyme doctors using LDI? Thanks. So yeah, Bob, LDI was one of those crazes in the world of Lyme that we all went through about 2 or 3 years ago. There still are a small portion of Lyme doctors that use it. What the idea behind LDI is that you take the germ that you're trying to treat and you kill it, and then you put it in liquid and you dilute it multiple times to the point that some of the original chemicals probably aren't even in there. And then when you do an injection of that into the body, it triggers a response from the immune system, where the immune system will respond against the infection that is in you. That's what the theory is, okay? I did try a number of my patients. I just was never that impressed with the outcome. And there's also the added problem that if you overshoot with your dosing, if you make it too strong, that sometimes people get clobbered and set back pretty far. It is not one of those treatments I recommend anymore for my patients. I haven't been that impressed with the outcome. Now, that's not to say some doctors still don't incorporate it into their practice, but I think probably the majority of us are no longer using these in our practice. Okay? All right. Thanks for that question, Bob. Hello, Megan. Hi, Dr. Ross. Since having Lyme and Bartonella for the last 5 years, I don't have the same shock-absorbing capacity in my joints any longer. Sometimes my joint and tendon can be burning, sharp, achy, and penetrating. If I'm ever able to get over this illness, is it possible to recover the ability of my joints to be pain-free and actually shock absorb again? My observation is yes, that basically you can repair, you can heal. That the joints without inflammation in them are not going to be as hurtful and are going to be able better to tolerate and be shock absorbers. All right. So to answer that question, yeah, you can get over it. Good luck to you. Hello, Anthony. Hello, Dr. Ross. I've been sick for 5 years. Oops, I think we answered that earlier. Hello, Flickering. Let's see. My son had mold toxin testing and only came back with one toxin showing at all and was in the normal range. Can someone have mold toxicity and not have toxins shown in the test? Our practitioner wants to treat him for mold toxicity. So it depends on the test that's being done. My experience as I've worked, the two major labs I use are real-time labs, and I have used Great Plains before. I have seen in a number of patients where their Great Plains testing showed nothing. If we went and did real-time testing, it showed up. I have a general impression that real-time testing and the technique that they use may be more accurate than the real-time method. But if you do both of those tests and nothing shows up, then I think it's safe to say there is not mold toxicity. That's my opinion. That's how I approach my patients, okay? Now, I don't know why your physician is so set on treating mold toxins if they're not showing up. There may be a reason behind that. You'll have to ask them. But in my opinion, just based on the testing, usually it's going to show up. Okay? All right. Thanks for that question. Hello, RK. What infections create constant sensation of heaviness in the throat? You know, when I think of heaviness in the throat, there's a couple of things I think of. Number one is that feeling of anything in the throat sometimes can be from yeast in the throat, all right? So if you've been on antibiotics for a while or if you have a lot of immune suppression, sometimes you can even get yeast up here. So that's one possibility. The other one I tend to think of is more Bartonella. Bartonella can give you a lot of throat sensations in this area as well, too. Okay? All right. Good luck to you, RK. Hello, Patsy. Hi, Dr. Ross. I'm trying to understand what is meant by bacteria resistance. Can you explain it? How long does it take for bacteria to develop resistance? If went off Septra for Bartonella for 2 years and started again, would the Bartonella be resistant? Thanks for all you do. Okay. So by resistance, you mean antibiotic resistance. So bacteria can develop antibiotic resistance for certain antibiotics. And so if you happen to be on Septra for a while, which everyone is also known as Bactrim or is also known as Sulfatrim. If you're on something for a while and it's working and then suddenly it stops working, then there might be resistance that the germ has developed to that. I have found in situations like that sometimes a year or two later, when it seems to me that the antibiotic stopped working because the germ developed antibiotic resistance, that when I went back in and used the antibiotic about a year or 2 years down the road, it worked again. So I don't think that all antibiotic resistance is permanent, because as the germs grow and replicate, some die off, some new ones are there. Sometimes I think there's a shifting sea of what that resistance is, okay? So it's not permanent is what my experience has been. I even see that with treating yeast. So sometimes there's a well-known phenomenon now that candida yeast are increasingly developing resistance to Diflucan. And so I have a number of patients where we used to use Diflucan to get their yeast under control. When it would go out of control, then suddenly it's just not working. And yet I might try it again 2 years down the road and it suddenly works again. So it is possible that this resistance is short-lived bacteria resistance, okay? All right. Good luck to you, Patsy. Thanks for the question. Hello, ME. Let's see, or me. Let's see. The area in which we live is unofficially endemic to tick-borne infections, so recognition in the medical circles is non-existent and access to prescription medicine is denied. As such, we have to seek other means of treatment by way of herbal regimens or traveling at significant expense. What do you recommend as an herbal kit to someone newly infected? What are the must-haves and must start this right now type of kit to have upon your shelf, ready and waiting? Are there items, especially from your online store, that would recommend specifically for this DIY kit to get treatment started? Bear with me here. I'm just trying to understand what the focus is of your question here. Okay, so you're asking specifically somebody that just got Lyme, that just got a tick bite or just got infected. You know, that's a hard one. So the only so let me tell you what's known. Okay, so what is known? We have good science that shows the prescription. And I know that's not your question. Just hear me out on this. Okay. The only science we have for acute Lyme is science involving antibiotics, prescription antibiotics. And some of that science is from mouse experiments and some of it's from human experiments. What we do know in an acute setting, doxycycline, tetracyclines are best because they go after Lyme, they go after Bartonella, and they go after acute babesia right away. Okay? That's what we know. We do not have any scientific evidence saying in acute Lyme that Otoba bark, that cat's claw, and that Houttenia and Pseudoacuta for Bartonella, and that Cryptolepis for Babesia work. I have to be candid with you, okay? So I want you to know that. There is nothing I can have you that I would recommend that I know works 100% of the time. So in my practice, if somebody has an acute tick bite, I will put them on doxycycline. Okay. All right. Now, I get you don't have that as an option. Okay. So keeping that in mind and keeping in mind that there is not science that says that what works best, what I would still recommend to have on hand would probably be cat's claw for the Lyme germ. I would probably keep I might do cat's claw. I might do Otoba. That's for Lyme. I might do Houttenia and Pseudoacuta. That would be for Bartonella. And I would keep some Cryptolepis around. All right. And if you read my Ross Lyme support protocol in there, I tell you how to use all of those. Okay. But I would do 2 Lyme herbs, 2 Bartonella herbs, and Cryptolepis for Babesia. Now, I want to be very clear. There's no science that says that's the right thing to do. Okay? All right. Good luck to me. Hello, me again. Let's see. Trying your recommendations of Crypto Plus, Artemisinin and SOD, and BLT for Babesia and Bartonella, as well as Capri Plus for yeast. Can all of this be taken together at the same time? Also, how long after entirely stopping Plaquenil? I'm not sure what you mean by your Plaquenil question here. Let's see. Trying your recommendations of Crypto Plus, Artemisinin and SOD, and BLT for Babesia and Bartonella, as well as Capri Plus for yeast. So yeah, those can all be taken together to answer your question. Capri Plus, everyone, is caprylic acid, oregano, and garlic. That's useful for yeast, 2 pills twice a day. BLT is a formulation from Research Nutritionals that has herbs in it that would target Lyme and Bartonella. And then the Crypto Plus and Artemisinin are herbs that would go after Babesia, basically. And yes, you can do all those together. If you're asking, do you need to have stopped Plaquenil for a while before you begin these? No, you can. You don't have to have any time between. In fact, I have people sometimes that will be on Plaquenil and take these at the same time too. Okay. All right. Hello, Margaret Lee. Let's see. My daughter has Lyme, Bartonella, Babesia. 10 months ago, her thyroid function tests were normal. Now she is slightly hypothyroid. Do these infections or the treatments affect the thyroid? She is treating with herbals and antibiotics. TSH went from 1.6 to 4.4. Free T4 normal. Free T3 slightly low, went from 3 to 2.7. Anti-TPO is a borderline positive. All right. So just so you know, the main antibiotic that sometimes can affect thyroid is rifampin and rifabutin. They have some effect and can lead to hypothyroidism when a person is on them. Okay, I have seen that happen. I haven't seen that happen as a direct result of any other prescription or herbal medicine. Okay. In terms of Lyme, the illness itself, when the immune system responds to these illnesses and it makes cytokines, those cytokines can interfere with how the part of the brain called the hypothalamus and pituitary work. That's the part of the brain that releases chemicals that regulate how your thyroid gland functions. And the excess cytokines interfere with that regulation. In addition, if you start killing a bunch of germs, you're going to, the Herx reactions that people get means you have cytokine surges. So you get more interference by cytokines with the thyroid. So it's very common as a result of these illnesses to have adrenal and even thyroid dysfunction. Sometimes can get worse as you start treating. I have seen that happen. Okay. All right. Good luck to you, Margaret Lee. Sorry, everyone. I was I actually came down with some pretty bad viral yesterday, so you're hearing me kind of get over it here still. I'm about 90% better today. It was not COVID. I tested negative by PCR testing and even a rapid strep or rapid antigen test. I also tested negative for the flu, but you're going to hear me cough. I may even lose my voice here later. We'll see how long I keep going here. Anyhow, let's see. Which do you recommend is more effective in treating Lyme with less side effects? So toba bark extract and cat's claw and cinnamon clove oregano oil or doxycycline? You know, the herbal is going to be have less side effects than the doxycycline. In terms of what you just outlined here, this herbal treatment is going to be more effective than the doxy too. The reason it's going to be more effective is doxycycline is only going to treat the spirochete form of the germ. In an acute situation, that's fine. But in a chronic situation, we also have to be concerned that Lyme also lives in a microscopic cyst form. So the germ has two appearances. Spirochete, that's a corkscrew-looking thing. Microscopic cyst is the other way that it can look. And it can morph from one into the other, okay? So your best treatments in chronic, not acute Lyme, but in chronic Lyme, is to have something that goes after spirochete, goes after cyst. Doxycycline for chronic Lyme is only going to go after spirochete, okay? The other thing that happens in chronic Lyme is we have to be concerned that some of these germs, after you've treated with antibiotics for a while, are going to go into hibernation. We call those persisters. And doxycycline does nothing for persisters. The cinnamon clove oregano can deal with persisters. There's some research that came out of Hopkins this year that showed that cat's claw might even deal with persisters as well too. Okay, so I'm keeping my comments more towards chronic Lyme with that one. Okay, all right. Thanks for that other question to me. Hello, Julia. Let's see. Hi, Dr. Ross. How do you know a mold remediation in your home is successful, safe to re-enter for a person with mold illness? Do you think it's possible? Thank you. Yeah, I think it is possible. I have to admit it's complicated. I don't know that it always goes well, but I do think it's possible. The thing I would do after you've had your home remediated again is I would probably do get an ERMI test and repeat it yourself and make sure that home is safe to go back into. Yeah. All right. Good luck to you, Julia. Hello, Mary. Let's see. Hi, Dr. Ross, and thank you for answering our questions. Can you take Diflucan if you have MTHFR, A1298C homozygous? I don't see a problem with doing that. I haven't seen people run into problems doing that. All right. Thanks, Mary. Good luck to you. I've got some people that wrote their questions multiple times, and so I'm just having to clear that out here. Let's see. I think I haven't answered this one. Hello, Lynn. Let's see. Nope. Looks like I've got I think we answered that one, so let me get rid of that too. Hello, Ricky. Let's see. Other than treatment with quinine for babesia, what does clindamycin work for in regards to Lyme and co-infections? Thanks for answering our question. So clindamycin, so there is a babesia treatment that involves using clindamycin, and that is a clindamycin quinine, and that's what Ricky is talking about. Excuse me. It is a treatment that has been actually has research on it that shows it can be effective for treating babesia. Okay. In terms of what else do we use clindamycin for? Well, let's talk about what it is. So there is a big family of a mega family, I'll call it that, of antibiotics, which are called the beta-lactams. Okay. And in the beta-lactams, you have penicillins, you have cephalosporins, and then clindamycin is another arm that comes off over here. Okay, so these are called the beta-lactams, all right? And clindamycin therefore is also used as what we call a cell wall agent. So the beta-lactams in general work on spirochete Lyme by causing it to develop holes in its covering. And the reason how it does that is it decreases the ability of Lyme to be able to repair injury to its covering. All right. So clindamycin can be used potentially to treat the spirochete form of Lyme, but as a cell wall agent, it won't get at Lyme that's living inside of cells, and it will not get at the cyst form of Lyme, but it might treat extracellular spirochetes. It might be effective against that. Okay. Hello, Thomas. Do you recommend a protocol for parasites? I got my Lyme from a cat bite, and despite being antibody positive for it, my doctor doesn't believe in parasites, but all my pets have them. So, Thomas, I don't just randomly treat for parasites. I want to know what symptoms you have. I want to know what testing tells me. And if testing does say parasites, then I'll treat for it. But I don't usually just randomly treat for parasites. All right. Good luck to you. Hello, Ken. Do you think Wi-Fi radiation is negative for covering from chronic Lyme? So so in terms of electromagnetic frequencies from your electrical devices and from your telephone wires and your electric wires, it is true that some people can be bothered by them, but not everyone. So if you find, an experiment would be is turn your Wi-Fi off at night and see, do you feel better for it? Do it as an experiment. If you turn it off at night and you notice that you're waking up feeling better the next day, and you do that repeatedly, you repeat that experience a number of times, then you might be a person that's having a negative reaction to your Wi-Fi radiation. Okay. So you just have to see, it's a very individual thing from what I can tell. Okay. All right. Thanks for the question, Ken. Let's see. Hi, Cindy. Let's see. Does the tick bring mold or fungus into the body? I am not aware that ticks transmit either mold or fungus into the body. Okay. Thank you. Let's see. Hi, Cindy again. Let's see. Is there any evidence that Lyme disease can be sexually transmitted? And is it possible for me to have gotten tick-associated parasites in my stool from caring for my husband who had Lyme disease? So I'm not aware that there is such a thing as tick-associated parasites, okay? Meaning that something that can be transmitted between you and your partner. So the answer there, I would say, is I don't know. I haven't seen that happen. In terms of Lyme and sexual transmission, let me tell you what we know. Okay, so first of all, there's no science that has proven that Lyme is sexually transmitted. It is true that many of us observe in our practices that when one person in a partnership has it, that there are also a number of sexual partners that also have it of the person we're treating. It seems to occur at a higher frequency than we might expect. And so therefore it makes you wonder, okay? In terms of science, what we know is that when you look at vaginal fluid in a female that has Lyme, and you look at the male ejaculate in men that have Lyme, there's been a couple studies done looking at those fluids. In one of the studies, 50% of women that had Lyme, the Lyme also showed up in their vaginal fluid. And in that same study, in 100% of men that had Lyme, 100% of the time it showed up in the male ejaculate. The other study that was done was very similar. It showed flipped results. Basically, in that other study, 100% of women that had the Lyme show up in their vaginal fluid, and 50% of men had it show up in their male ejaculate. Okay, so what we know is that it can be in your sexual fluids. Okay, now keep in mind, being in sexual fluids doesn't mean that it gets through to your partner, because we have skin as a defense, we have immune system as a defense. So things in the fluid don't always get through. Okay. All right. Then there is one study that you will read that was just a horrid study, but it's out there and you'll run into it. And it's a study by Stricker and a number of other people that involved 13 people. So there's already a problem with that study, and that anything that only has 13 people in it cannot really be generalized. It just can't. It's too small of a population to know if it's really valid for the population as a whole. But in their study with these 13 people, there were in the 13 people, there were 6 people that were in partners. So 6 of the people, there was male, female, male, female, male, female partners. All right. And they went ahead and looked to see what strain of Lyme would show up in their sexual fluid. So in each of the couples, they each had identical strains of Lyme. So the man had a strain of Lyme in his ejaculate that was same as the strain of Lyme that was in the female and the male. They were the same. Okay. Now, there's a big problem with this study, and that's true that, yes, they each had the same strain in their fluids. The problem is the authors of the study did not control for the last time the male ejaculated in the female. So when you're measuring something in the female's vaginal fluid, it either got there because she is infected in her bloodstream and it leaked into her vaginal fluid that way, or her male partner made a sexual deposit of Lyme germs into her vaginal fluid. And so when you're measuring it in the female's vaginal fluid, it's not clear who's you're measuring. All right. And again, as I said, just because the male may deposit it in the vaginal fluid, there's enough barriers of protection to keep it from getting into the bloodstream. So that study, I don't know what it means. I don't know what it means. All right. So what I would say is I think there's a risk it could be sexually transmitted. What I would also caution is that even if it can be sexually transmitted, a lot of us have immune systems that can deal with this thing. The majority of people that probably have Lyme exposures, either sexually or from a tick, your immune systems probably deal with it just fine. Okay. So anyhow, unfortunately, it's an open area that we just don't have solid evidence in. Okay. All right. Good luck to you, Cindy. All right, let's see here. Hello, James. Let's see. Hi. I've had moderate case of Lyme that was treated years ago with 4 weeks of doxy. I never quite got over it, but have not taken any treatments in several years, hoping my immune system would eventually beat it. Recently, for the first time, I had liver and kidney pain with climbing ALT, AST, and alkaline phosphatase and creatinine levels. What meds and supplements can I use for Lyme that puts the least stress on the liver and kidneys? Thank you. I hate to say this to you, James, but they all put some degree of stress either on the kidneys or on the liver. For me, to give you the best advice, which I'm not going to tell you because I need to know more. I need to know exactly what are your ALT, AST, what infections are we talking about treating? There's a whole host of things that I need here. So it's not a simple answer, actually, unfortunately. All right. Good luck to you. Hello, Lainey. Let's see. What are the symptoms of testing for strep-induced pandas? Are there any capable herbal protocols for strep? Are there any recommended supportive supplements for the specific condition? So, Lainey, I'm not the best source when it comes to pans and pandas, just so you know. I'll be honest about that. So in terms of using herbal protocols for pans and pandas, I don't know how to do that, and nor have I seen protocols that do that, okay? In terms of testing, basically, most doctors, to see if you have strep, are going to do titers of something called ASO. And if that's elevated, that can be an indication that there's pans or pandas, basically. Okay. All right. And they're, the symptoms of PANS and PANDAS, the big symptoms are acute neuropsychiatric problems that develop after an infection. All right. But beyond that, I don't have specific information for you. Okay. All right. Good luck to you. Hello, Carter. Let's see. Do you ever see alternating between hyper and hypothyroid symptoms? I have not seen that occur in my practice. I mean, I'll have people that sometimes start hypothyroid, and as we get their Lyme under control, they become hyperthyroid because or normal thyroid, and sometimes maybe even go to hyperthyroid. But I don't see like one day you're hyper and the next day you're hypo, or 1 week or 1 month. I just haven't seen that occur. Okay. All right. Thanks for the question. Hello, Susan. Let's see. Is weight and muscle loss common? I feel like no matter how much I eat, I'm losing weight. So there is a small group of people that do have a hard time maintaining weight with this disorder. So first of all, in terms of your muscles, excess cytokines that I've talked about tonight can lead to muscle wasting and muscle mass loss. Also, not exercising or being physically active because of the illness, because it's hard to do it when you feel this bad, will sometimes lead to muscle wasting and loss of muscle mass as well, too. Some of the medications that we give, herbal and prescription-wise, make it hard for people to eat because of side effects of those. And so some people do lose weight because of that. When it comes to weight loss, though, there's a number of things you've got to figure out. Number one, you got to look at thyroid. You got to determine whether you're having side effects of medicines based on the history. You've got to figure out, are you a person that fills up easily? In which case, do we need to give you things to help your stomach empty out quicker? So there's a lot. And then do you have diarrhea? Do you have undigested food? There's a whole host of things that I would need to ask you more about. Okay. All right. Thanks for the question. Hello, Amy. Let's see. I feel like I have symptoms similar to Lyme or to limb-girdle disease. Can Lyme mimic this, or is a comorbidity possible? Lyme can mimic it, and a comorbidity is possible. Both of those situations. Okay. All right. Good luck to you. Oops, I just accidentally got rid of a question. I apologize, David. There was something you asked me, and I was starting to read it and tried to post it, and I actually X'd it out. Sorry about that. I don't have a way of pulling it back either. Hello, Margot. See, I feel like I have a weak diaphragm making it difficult to breathe. Have you heard of this? Yeah, I have some people that do have that. Again, you can have muscle weakness at any place there is a muscle. You can have neurologic dysfunction of any nerve. So the diaphragm is controlled by a nerve, and that nerve may be dysfunctioning. So yeah, it's possible to have that happen. Somebody just asked me, are there, I don't know what's happening. I'm getting a dysfunction here, it looks like. But somebody just asked me, are there new treatments of promise here in the U.S.? The only thing that I see that's on the horizon that may come about sooner than later is a drug called azacitidine. That is a type of penicillin that appears to have a good benefit on treating both persister and growing Lyme. It is already FDA approved for other situations. There is an investor group that's been trying to put together a company that will actually manufacture it. And I'm not sure where they are in that process right now. Okay. All Thanks for the question. Hello, Bradley. Let's see. Have you used febendazole or mebendazole? I have used them, but I only use them for parasites, and it all depends on which parasite is there. So usually when you're planning parasite treatments, you're going to kind of look at what's there and look at sensitivities of antiparasitics to see if they're going to work. So those would be situations where I have used that before. All right. Hello, Flickerine. Let's see. Would Bartonella cause periodic side head pressure? Is this a symptom of Lyme? I would say it could be the one. And to figure out which one it is, I would want to know what other symptoms are going on so I can figure out whether it's more Lyme or more Bartonella. All right. Hello, Flickerine again. Let's see. If someone herxes really hard on antibiotics, is it better to use herbals at a slower rate? Would taking herbals first and then going to antibiotics be useful? So, first of all, if I've got somebody that's herxing, you want to do things to manage the herx. You want to do things to limit the herx. And one of those is make sure you're on a good anti-cytokine protocol. And things that limit cytokine production are curcumin. Curcumin is quite useful at doing that. Curcumin is a component of the Indian seasoning turmeric. And if you take it, liposomal pills of it, it gets very well absorbed and gets inside of white blood cells and can limit cytokine production. The product I like using for that is a product made by Thorne called Mariva 500. You want to do 1 or 2 pills of that 500 milligram pill 3 times a day. In addition, for people that are having a lot of herxing problems, I want to get them on glutathione. I want to use a liposomal glutathione. Liposomal glutathione is basically glutathione that's microscopically wrapped in fat to increase absorption. The company that makes liposomal glutathione, a product that I really like, is a company called Research Nutritionals. Their product is called Trifortify, and you do 1 teaspoon once or twice a day. Again, they've got some really good studies that show great absorption of their product. And so I would get people both on curcumin, and I would also do the Trifortify. If they're still having a lot of problems, it is true that for my patients that have significant Herxheimer problems, that sometimes what I will do is I will switch over to herbal regimens. And the herbal regimens, because you're using drops and you can microdose easier, it gives you more flexibility. So I usually start people at 5 drops twice a day of the various herbal tinctures, and then have them add 1 drop per dose per day. And I have them stop increasing when they start to get Herx reactions. And I have them stay at that dose until the Herx reaction passes. And then after that, they can start going up on it again, basically. Okay. So it gives you greater flexibility to regulate your dosing of the antibiotics as a way of regulating the significance of the Herx. And then, yeah, you can always go back to the prescriptions in the future. Okay. All right. Thanks for the question. Hello, Susan. Let's see. What do you think of IVIG for small fiber neuropathy? So everyone, IVIG stands for intravenous immunoglobulins. So immunoglobulins are antibodies, basically, right? And they can be helpful for people that have inflammation of the very small nerve fibers in their hands and their feet, basically. The way you determine if you have something called small fiber neuropathy is you have to have a skin biopsy done, and then they look under the microscope at the nerve fibers to see if they are consistent with this thing called small fiber neuropathy. IVIG is a treatment that has been shown to be beneficial. You have to get regular infusions of it. It can be helpful. Okay, now there's a few downsides. Number one, the way that this product is put together is it's basically immunoglobulins that are taken from donors, blood donors, okay? And so these blood donors are screened. Their blood is screened to see if they have various infections. However, there's only so many infections we screen for. And so you always have to wonder, is there something that gets through that could infect you? All right. So there is a risk when you do IVIG of picking up something else in your body that you don't want. Okay. Second thing with IVIG is that because you're taking in blood products of another person, you can have an autoimmune or an immune system reaction against the IVIG, actually. And so sometimes people get quite feverish and they become quite fatigued while they're doing the treatment, and sometimes even develop allergic type reactions. So they have to be monitored, especially when they first start doing it, until we know if they're going to have trouble. All right, so those are just some things to think about. But can it be useful? Yeah. Are there risks involved? Yep. Yeah. So so consider that. Okay. Consider it with your doctor as well too. Okay. All right. Good luck to you. Hello, Jane. Let's see. Hi, Dr. Ross. If the infection is in the spinal fluid, will oral antibiotics work? It depends on the oral antibiotic. So if you have a spinal fluid infection, it's usually better to go with an injectable antibiotic, usually. Okay. However, there are antibiotics that can get through. So for instance, doxycycline and minocycline can get into the spinal fluid. All right. So there are some oral antibiotics that can get through. Okay. All right. Good luck to you, Jane. Hello, hi. Let's see. I have mold toxicity for the past 2 years, and I'm on cholestyramine since that time. This January, I did a genetics test and found out that I have Lyme and Bartonella. I started with Otoba bark, cat's claw, and the cinnamon clove capsules. I felt okay for 2 months, then my symptoms came back again. Then last month, I tested positive for parasites. I heard that if I have parasites, then I should treat it first. I talked to my doctor, and she said that I need to stop the Lyme herbs and I need to keep taking cholestyramine twice a day and parasites medication for at least 2 months. After these 2 months, I can reintroduce the Lyme herbs, and later I will add the Bartonella herbs. My questions are, I'm still in the moldy house because I can't find a clean house that I can afford to move in. Do you think I can keep taking cholestyramine for all of this time? Also, I heard that leaving the moldy house could help in getting rid of the Lyme without medication. But in my case, I'm still in that house. So, there's no length of which it's okay to be on cholestyramine. In other words, cholestyramine doesn't lose its effectiveness the longer you're on it. And in my patients that have chronic exposures to mold toxins from their environment, sometimes I just leave them on cholestyramine to bind up any of those mold toxins that get absorbed into them. So I don't see a reason that you can't take it from just the fact that you're on it for some period of time. Okay. All right. It is true if you have mold toxicity that it may make it harder to get over the Lyme. That doesn't mean it's impossible, but it may make it harder. All right. Okay. Good luck to you. All right, let's see here. Listen, everyone, I'm sorry. I'm starting to fade here. As I said, I'm getting over from something from yesterday. I'm going to call it quits here tonight. So we're about an hour and 10 minutes into it. I'm glad I was able to make it this far with you this evening. Keep your eyes out and your email tomorrow morning, somewhere around 9 to 9:30 in the morning. You'll get an email from me announcing that I have created the synopsis of this webinar, and I'll send that recording, the link to the recording out to you as well. Okay. So I've enjoyed being with you here tonight. I'm sorry I'm going to have to wrap up here a little bit early, but I'm fading. My voice is starting to go too. And so I want to go home and take care of myself. So good night, everyone. And we'll see you in a couple of weeks. Okay. All right. Bye-bye.